Thank you. And I'm now the final barricade, I believe, between your plastic seats and the alcohol at 5 o'clock. So it's intense pressure to be the wrap-up speaker. And I seem to get stuck with this wrap-up speaker role with some frequency, not only here at Massey, but more recently at a neuroscience symposium in Montreal that had the leading figures in neuroscience speaking all day, and then they asked me to wrap up. And I got to the podium immediately after Sidney Brenner stepped down. Now, rule number 6 of effective public speaking is never speak immediately after a Nobel laureate in your field. And I really had nothing to say. Today we've had a kind of intellectual smorgasbord in comparison to which I am the world's tiniest slice of Sachertorte. So you may be calorically actually in need of some insulin right now, or alcohol. So I'm, much as I would like to make some comments, I have about 90 minutes worth of comments I'd like to make about what we've heard today. Let me just say 2 very quick things before I get into my little treat. The 2 things are that, particularly in Jeff's talk, but in the other ones as well, you heard en passant reference to the problems of people with severe and persistent mental illness, which happens to be my line of work. And if we want to look for inequities in our healthcare system, look no further than anybody living in any city in Canada who happens to have schizophrenia or bipolar disorder. Look at their life expectancy being maybe 2 decades less than other Canadians. Look at their access to specialty medical care being markedly worse than for other Canadians. And remember that, in fact, this is a common set of afflictions affecting every family. We heard passing reference to the need for human health resource strategies for this country. This is always popular because people love to count things. How many beds do we have? How many doctors do we have? How many nurses do we have? I find these stunningly stale models of thinking because, in fact, how many doctors we have makes little difference. It's what they do with their time that counts. And we have, I am collaborating with Paul Kurdiak at CAMH and ISIS on a paper that's, I'm pleased to say, already been rejected by one prestigious journal, and we're going for number 2, that looks at the supply of psychiatrists in Toronto, in Ottawa, and in the rest of Ontario. And what that study shows is that in over-psychiatrized cities like Toronto and Ottawa relative to the rest of Ontario, access is still a huge problem. Quadrupling the number doesn't change the fundamental problems. So with those editorial asides, I will turn to the little bonbon that is now a tradition for me at these Massey Grand Rounds, having attended, I think, 5 of them now and spoken at 5 of them, which is I set myself the challenge during the talks of trying to write a limerick that reflects some of the content of what we heard today. So bear with me because this is what we call just-in-time poetry. Seated in the upper library, there are few events more classy than when docs and profs teach and opine at grand rounds held at Massey. Overseen by Abby Angel with his fuller brush mustache, led by J.F. Siri and Doherty with passion and panache. We were welcomed by John Fraser, now in direct line for the throne. With every year, his standing and his forehead both have grown. We were then greeted by the deans, Roger Strasser, Kathy Whiteside. To keep my job, I made a note to best stay on her right side. We're leveraging technology now, which is absolutely awesome. So hi to all our colleagues who are watching this at NASM. And best regards to all of you us deep in Mississauga, a wonderful new campus with which nothing really rhymes. The theme this year is equity, and who could be opposed? And yet its many facets were most artfully exposed. We heard first from Jeff Turnbull, head of Inner City Health, who showed us the sequelae of inequities of wealth. In Canada, for homeless, costs are high and outcomes low. We must deride, we can't abide the system's status quo. Eva Grunfeld was most heartfelt as she spoke of speed of death, how inequities will shape the timing of a final breath. Her heady presentation compels us to acknowledge that based on recent data, we must say that power is knowledge. Hurley's an economist, but disregard your guild impressions of academics who predicted 9 of our last 5 recessions. In terms, in terms of our health system and its ever-circling vulture, he said the cure is not the money we need to change the culture. In the past, we've measured waiting times for hips, eyeballs, and knees. We need to shift our thinking to a world of chronic disease. Now, I was hoping James was going to have more opportunity to talk. I've never heard him so mute in a gathering.
It was really tough.
Yeah, I think his teeth have been ground to powder. For a view of, so I actually had to write this when James went up to the dais. For a view of global health exposed, look no further than Orbinski's. There hasn't been so much revealed since the night they raided Minsky's, which is the only thing that really rhymes with Orbinski. Today, James was an able chair, introducing guests with grace and signaling them to stop to keep the session's pace. Rick Glazier spoke of where we live and why, and just why place does matter. It turns out that your residence can make you fitter or fatter. We need to think of what can change environment enablers to twist the words of Robert Frost, low walking makes sick neighbors. I'd be remiss if I dismissed our thoughtful Michael Bliss and his nuanced view of equity and what is really fair. Our much vaunted universality never came to be reality. On Bliss's bus, if you can, you ought to pay the fare. It's said that hurried doggerel is the lowest form of verse. A Hallmark card on Mother's Day is the only thing that's worse. But this is just the fender trim on a very solid chassis, the all-wheel drive performance car that is Grand Rounds at Massey. Thank you.